Hi, my dear PG aspirants and pediatric postgraduates. We normally don't hear respiratory sounds, but when we hear, it can be either stutter, snoring, stridor, wheeze, grunt, etc. These are all respiratory noises. Respiratory sound is physiology, whereas respiratory noise is pathology. But these respiratory noises helps to identify the site of pathology of obstruction as well as the etiology. Today we are going to discuss about these respiratory sounds. Welcome to my channel. To understand the art behind these respiratory noises, let us know simple clinical anatomy and physiology. Look at this picture. It shows the cross section of the human body, showing the entire respiratory tract starting from the nose to the alveoli. Let us draw two imaginary lines. One imaginary line at the level of the glottis and another imaginary line at the level of the junction of extrathoracic and intrathoracic trachea. Let us presume any lesions causing obstruction above the level of the glottis in this region involving nose, nasopharynx, oropharynx, supraglottic region often produces inspiratory noise, whereas any lesion involving your subglottic region and extrathoracic trachea produces biphasic noise, a more of inspiratory and a little bit of expiratory noise. Any lesion causing obstruction involving your intrathoracic trachea, bronchi, and alveoli usually produces an expiratory noise. So, what are all these noises? Your inspiratory noises are nothing but your stutter, snoring, your stridor, and your biphasic noise is nothing but your biphasic stridor, and your expiratory noises are nothing but your wheezing and grunting. The next thing that you need to know is Hollinger's law. For that, you need to draw an imaginary line at the junction of nasopharynx and oropharynx. Above this line, you have your nose and nasopharynx. And remember, any lesions obstructing nose and nasopharynx produces two kinds of sounds, such as stutter and snoring. They will manifest only during sleep and disappears by mouth opening or when the child is awake. So when mother says, my child is having noisy breathing only during sleep means either it can be stutter or it could be snoring. Any lesions involving below this imaginary line, involving your oropharynx, your supraglottic region, subglottic, trachea, bronchus, everything will manifest both during daytime as well as during nighttime. And these sounds are stridor, wheezing, and grunting. Let us first decode respiratory sounds with the inspiratory component. It can be either low pitched or high pitched. The low pitched noisy breathing that arises as a result of secretions in the nose is called as stutter for a pediatric pulmonologist, but for a common pediatrician, nothing but conducted sounds occurs as a result of acute viral coryza. Listen to this sound, stutter. Yes. The next low pitched sound that arises as a result of pathology in nasopharynx is called snoring. The most common cause for snoring in pediatric age group is adenoid. Listen to this snoring sound. These two are low pitched sounds. But what about this high pitched sound? Just listen. High pitched sound that arises as a result of pathology in supraglottic region is your stridor. The most common cause for stridor in pediatric age group, particularly in young infants, is laryngoalacia. Your stutter, snoring, stridor has exclusive inspiratory component only. But we have one more sound in which predominantly you will have inspiratory with a little bit of expiratory component, otherwise known as biphasic stridor, that occurs as a result of pathology in the subglottic region. The two most common causes are, one is subglottic stenosis, another is acute laryngotracheobronchitis. Listen to this beautiful biphasic stridor. Let us decode respiratory noises with expiratory component. Listen to this sound. Purely expiratory, because the site of obstruction is in the intrathoracic trachea, bronchus, or in the alveoli. If the site of obstruction is in the intrathoracic trachea or bronchi, then it is low pitched expiratory sound, otherwise called as wheeze. It can be either monophonic without any response to salbutamol. Then we will think in terms of foreign body in the right or left main bronchus, or it can be an underlying airway malicious. If it is polyphonic wheeze and responding to salbutamol, it can be acute wheeze flare. The high pitched respiratory sound with an expiratory component is grunting, which arises as a result of pathology in the parenchyma. In infants, it is due to hyaline membrane disease. In children, it is usually due to pneumonia. Thanks a lot for your patient listening. With this basic background, let us decode so many case scenarios in our part 2.